This is Boomer Life on CIL 650.
And welcome back to the show. This is Boomer Life. I'm Zach Spencer on CIL 650, and we have the Snore Dentist in studio, Dr. Charnel Muir, snoredentist.ca. Was it hard to get that domain?
No, actually, it was...
You invented the whole category.
I know.
There you go. So snoredentist.ca. If you're listening to this, you know somebody that snores or maybe not sleeping well, make an appointment and go and get a consultation. So I talked about before the break the percentage of people that come in because of the annoying noise, right? The snoring, and for men, it's more acceptable that men snore. Women may be a little more embarrassing. Mm-hmm. And how many? So the percentage of people that come in because of that, and then the other percentage that come in because they're not sleeping well. They're tired during the day, and they're being maybe recommended to see you to help with that. What's the breakdown?
Yeah, probably about half of my patients come in because of snoring is an issue at home. Mm-hmm. And of the other half, about half of those would come in for fatigue, and the other half would come in because they either have previous testing or they've failed another therapy, or they need an alternative to what they already know they have.
Didn't you get an email recently from someone who said that their partner is no longer snoring and they're...
Yeah.
Hey, why don't you read that one out?
I get the best emails from patients, and it's really, I just love getting them. But I just got this one last week that said the appliance is great. I slept without it for one night, and my husband was shocked at how loud I suddenly was again. Mm. And we're both sleeping much better, thank you.
Well, that's good.
So, it literally cannot be that big a difference. And you could take it out, and within a night or two, you're back to making that horrible noise again. And, they forget. We all forget as something's gone away. We forget how loud it was. We forget how disruptive it was, and we get lazy maybe. And maybe there was one night that she just, she'd already gone to bed, and it was, I don't want to get up and go get it. And then she gets the elbow in the back.
Go and get it.
Go again, get it. Right? Yeah.
And so when you get the appliance fitted, typically how many nights do you feel okay?
Most people wear it through the night in the first 1 to 3 nights. Right. We always tell everyone, give the first 1 week, get used to it, make sure that you're used to it. You might have a little extra saliva for the first week or two. Your brain thinks something's in your mouth, so it might make a little bit of extra saliva. Make sure you put some chapstick on at bed to protect your lips if that happens. But most people within 1 to 3 nights are wearing it through the night.
Okay, so how do you know... and you have testing for this, that somebody isn't just snoring and it's inconvenient, it's a real sort of health issue and they're not getting a good night's sleep. So how do you determine that? And do you do this test on everybody? Right.
And it's important to determine that. You don't want to test someone or not test someone and treat them for I just snore. Mm-hmm. I know I just snore. That's all I have. And the new guidelines are very clear about that. You should not be treating snoring, even yourself. You shouldn't be treating your own snoring with an over-the-counter appliance until you know that's exactly what you're treating. So all of my patients, when they come in, if they have not had a home sleep study or an in-hospital or laboratory study, they all go home with the home sleep monitor. It's easy to wear. It's easy to do, it's not invasive, and people really should do it so that we really know what we're treating.
Because I understand that snoring is blocking the airway to some extent. That's what the noise is. It's the soft tissue at the back of your throat flapping back and forth. So it's becoming restricted and unrestricted as it's flapping back and forth, right? So when does that go from being sort of troublesome to almost, not critical, but, being a major issue?
Right. And it can be like snoring itself. You can imagine if the tissues are fluttering and fluttering and fluttering every time you breathe in and or out every night, it's going to limit the airflow. Mm-hmm. And that limited airflow can definitely limit your oxygen. not only that, the vibration from snoring itself has been shown to be irritating to vessels like the carotid artery. Well, that's the big artery that's running in the side of your neck. And if you can irritate the lining of the carotid artery, it will pick up that atherosclerosis, that plaque that grows in there. Well, that's one of the leading causes of stroke. So snoring has its own problems on top of that. But you're right. All it is the tissues getting close enough together that they create air turbulence, and then the tissues flutter. And then the next progression from that is the airway collapsing around usually the base of the tongue area. And that's where you don't get any airflow, or even 25% or less of your airflow. And that causes real problems.
That's sleep apnea.
That's sleep apnea.
Dr. Charnel Muir is my guest, the snore dentist. Now, walk us through the kit. So someone comes to see you, and then you send them home with the test,
With
right?
the monitor,
With the
yeah.
monitor. So what is it? It sounds to me like, oh, you're going to be wired up for the night, but it's not that bad, is it? People do it quite easily.
Yeah,
so
and I think a lot of people, I don't know if you've ever seen in the Hollywood movies, or if you Google sleep study or anything, and they show you the in-hospital version. Well, you've got wires stuck to all sorts of part of your head and your legs, and you've got all sorts of wired up bits and parts to you. And that can be quite intrusive.
And they do that.
And they do
but
that.
But that's not what you're doing.
But that's not what we do. The home version is a cut-down version of that. It's really all that's required for most people. It's used to rule in or out level of sleep disordered breathing that you have, whether it's just snoring, we call primary snoring, or whether there's a degree of sleep apnea involved. There is a stretchy effort belt that goes around your rib cage. It's easy to put on. You just do it up snug enough that it doesn't slide around when you lift up your arms. Attached to that is a small little nasal cannula that just measures the airflow going in and out. Doesn't blow air at you. Doesn't do anything like that. It just sits there.
And how is that held?
Well, it actually fits quite snugly onto your nose, and then you wrap it around your ears and do up the toggle. Like, you remember the old earbuds we had that had that toggle underneath there, or the headphones? That type of thing. But I often ask patients to put a little piece of medical tape on either side of their nose, just to hold the little prongs right by their nose, so that if they do roll side to side, it doesn't dislodge.
Right.
Yeah.
Right. So you have, it measures the air going in and out of your nose.
That's all it's doing.
And then you have around the chest.
Yeah, the stretchy belt that goes around your chest, and it's just going to go on your rib cage, and it expands every time you breathe in and contracts every time you breathe out.
Anything else?
Then the finger probe. And a lot of people will have experience with the finger probe before. It's something that if you've had a surgery in the hospital, they'll stick a little finger probe on your finger just to make sure you're still getting oxygen and your heart rate. And that's all it does. It's just a little stretchy rubber cap that sits over top of one of your fingers.
So what is it measuring? So I'm guessing the airflow in and out of your nose is less if you're breathing through your mouth and snoring.
It is.
So is that how you know that? How do you put the pieces together to know that somebody's snoring or not getting enough oxygen?
Well, there are two parts. One is that we're going to measure airflow in and out using the nasal cannula in relationship to your rib cage expanding. So if you go to breathe in and your chest expands, but the airflow is limited. So it's already knowing what your in and out airflow is because you put it on when you're awake. And then as you're falling asleep, you're breathing well. And then at some point, if you go to breathe in, but there's no airflow going in through your nose, they know, something's blocked. So it monitors that for airflow limitation. And then it checks the finger probe part and it says, now is that lack of airflow causing your oxygen to drop? Is your oxygen dropping down 3% or more during that period? And it usually happens actually slightly delayed after the airflow because, of course, the blood has to circulate all the way around, right? So it puts all these parts together and it tells us whether you have just snoring. So is there that air flutter noise, but there's still flow of air? but is it doing it in a fluttery sort of way rather than a smooth way? It tells us whether or not you're having a partial closure of the airway, which is a limitation or volume of air is less. And then it tells us whether you have a blockage in the airway where you have no airflow at the time your rib cage is trying to breathe.
Now, on previous shows, you explained that some people can stop breathing numerous times per hour, and other people just stop a few times, and neither is good.
Well,
So,
yeah, there's
how
actually
does
a
it-
normal level,
Right.
Right. So we consider normal if you don't breathe or stop breathing 0 to 5 times an hour. Some people will skip breaths, so they'll have their respiratory center in their brain will just not stimulate them to breathe. Some people will have natural obstructions that happen while they're breathing. But any level of 0 to 5, we don't consider sleep apnea. Once we get into 5 to 15 times an hour, that's mild. 15 to 30 is moderate. And anything over 30 times an hour, we consider severe. And we don't actually have an endpoint for that. I just recently had a patient in that stopped breathing 103 times an hour.
Wow.
So
That's every 30 seconds.
it is.
Almost every 30 seconds. Yeah.
And every event has to be at least 10 seconds or more. Right? So we're
So that means, okay, say it was 30 seconds, and then you're not breathing for 10 seconds. That means you're only getting oxygen every 20 seconds.
yeah. And some people will have more shorter events.
Right.
Some people will have fewer but longer events. So
But your brain, your body fights to get oxygen, so it
Oh, yeah.
wakes you up, right? So that's why you're not. First of all, you're not getting oxygen, but you're not getting that deep sleep that you need.
That's right.
So your body wakes up and says, "Okay, I need air," and is
yeah,
that the cycle?
it goes into fight and flight.
Yeah.
It basically thinks the enemy is coming along strangling you, right? Like it thinks there's a threat. So you may not wake up. Many of my sleep apneic patients say, I sleep well. I sleep right through the night. I never wake up. But their brain wakes up. So their brain lifts them out of deep sleep, keeps them in light sleep.
And you mentioned before, when was the last time you remembered a dream? Mm-hmm. And that's a telltale sign.
It
too,
can be, for sure, because people won't dream as much. Their body will resist letting them go into dream sleep if their sleep apnea is worse in that stage. It'll protect them from it. Yeah.
We're speaking with the snore dentist, Dr. Charnel Muir. You're in North Van, right?
I am.
You're just off Marine Drive.
Marine and Bewick.
So explain the car wash. Everybody knows
Oh, yeah.
it's the Oasis car wash,
The
right?
Oasis Car Wash. So if you know North Van at all, the Oasis Car Wash has been there for an awfully long time at the 5 corners of the roads there. But if you take the Westview exit off Highway 1 and you come straight down Bewick and Marine Drive is that kind of 5-road intersection, kitty corner from the Oasis Car Wash.
But you also travel. You go throughout parts of the province. So maybe someone's listening on the island. You do trips to the island. You go out into the valley. So you get around to visit different clinics, right?
That's right. And part of my passion is helping people anywhere I can.
Mm-hmm.
You know, I think it's important that I make myself available in other areas as well, because there really is so few of us. So I go to the island once a month, and I'm on the island for the better part of 1 week every month, and I treat patients from Victoria all the way up to Campbell River. And then about once a month, I'll go down to the West Broadway area in Vancouver for patients that can't get into North Vancouver. And then based on demand, usually sometime in the spring and the fall, I'll head out to the valley and I'll see patients in Abbotsford and or White Rock.
Now, people are more than willing to come and visit
Yeah.
the North Shore if they have an issue. 'Cause
Yeah.
I'm sure people are like, get this fixed.
That's right. And it's important that they get it fixed properly. And it's important that they get the medical follow-up. and it's important that someone knows how to measure how the appliance is working and whether it needs to be adjusted. And all of those things do require attention, and they should have it looked at.
Dr. Charnel Muir, snoredentist.ca. The easiest way to get an appointment is to go online.
It is.
Because you could be phoning now and the office is shut, but go online, snoredentist.ca, and you can get an appointment. We'll be right back right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.